Welcome to Talk with Maria. Home care workers are the backbone of our healthcare system, providing critical care and compassion and empathy. Today, we're honored to have leaders from GR Home Care to discuss the impact of home health aid services. Please welcome Donnell Gallucci and Mildred Gallery. Oh my goodness, we are making history today. It's 2025. We're doing so many things in home care. It's the greatest thing, according to the Department of Labor. It was the greatest part of the economy, caring for people at home. And you played this great, vital part in making all these moving parts. Mildred, how are you?
I am happy to be here. I'm excited to always have a conversation about home care and the nuances and what's going on and what's in the now and what's on the table. And having this conversation with like-minded people is wonderful. So talking about the backbone of home care.
Yes.
Home care workers are just that, the backbone. Without them, we don't have home care. So it's super important, and we know that there are lots of changes going around in home care, but we want to let everybody know that we are still here for you, and that we're going to get through the rough times that we're starting to embark on, and we're going to give each other different support systems, and we're going to talk about all those different things that we need. Yeah.
You know, when someone is home and they're sitting there, and amazingly enough, you think that people know about home care. They know how it works. They know how to get Medicaid. They know how to get help if they're home and they don't have enough money to do so, or if they have long-term care insurance. What it takes to get help at home.
Most don't know it until they get it. Until they get it. And then we get to Donnell.
And then we get to Donnell. Donnell, tell us what you do for GR Home Care.
So my purpose in life and in my job is to go and help those in need of home care. So if someone needs help, they'll call me, and I could go to their house or go to the rehab or hospital, and then be able to start the conversation of the possibilities of home care.
And I know this job didn't just land on your lap. You went through a very trying time in your own life.
I did, yes.
You want to just talk about that just
Sure.
a little bit? Because
So
I know you come with so much compassion.
Yes, you're right. Back in 2016, I was diagnosed with breast cancer, and I had myself 12 rounds of chemotherapy, 30 rounds of radiation, and I momentarily felt and knew the need of help that I needed in order for me to just be able to get out of bed, be able to get dressed, and be able to do those normal things throughout the day. I needed that help temporarily, so I can definitely relate to anybody that calls me and says, hey, my mom, my grandma, my dad, my grandpa, my uncle, they all, they need help now.
Yes.
So I've been there.
This feeling, who feels it knows it.
Put perspective into it.
Yes.
Absolutely.
And so with sickness, so we have all these needs and wants in the world. And when you get sick, none of that matters.
I know. Not even money matters.
None of it. No.
You're looking at money
Your
if you have a
health
bad back pain enough, and you're like, this can't heal me. Nothing makes a difference.
No. That's right.
You want a hand to hold. You want someone to be there for you. You want someone to care for you. And that is what makes the difference in home care.
Yeah, and that fundamental human connection.
Yes.
Especially we're going into a world where computers, and we're talking about AI and robots.
Yes. Oh my God.
I don't want a robot taking care of me.
No,
I want a
absolutely
person.
not.
I want a human.
Well, one of them might just drive themselves.
No, thank you. No, I want flesh and flesh, and and that
it's very
human,
important.
that human
That
connection.
warmth.
Yes.
Yes.
To tell stories, to just talk about life.
Give you something to drink.
Yeah, and also. We want to be at home, and we want to live good. And even if you have to be in a facility because that's really where your level of care is needed, we're here to help with everything.
Yes, because you do private home care
Absolutely.
in facilities as well.
Yeah, absolutely. With GR, so what's different, or what we feel is different about GR, and why we love this company so much, is because we really are putting forth what's best for everyone in home care, not patient,
home care workers.
Especially patient, client, agency. We're actually trying to navigate it together and trying not to, we're trying to bridge the gap between these spaces. So when Danielle, I know because we work together. I'm heavy on recruitment, as you well know, training people and having people come into the homes to take care of people, but also getting care. How do you get care? How does it happen? Well, Danielle is an expert at that. And
absolutely,
what we love and what I love about Danielle is that she doesn't drop the ball. She knows, like she can speak to her own sickness, so she takes that with her when she goes to visit you. She takes that companionship, that compassion, and so do I. When you've been through things, you don't want others to suffer.
That's correct.
And so we don't want others to suffer, and we know our job, and we know how to navigate
you
it.
put speed on the need. So Danielle, someone calls you up, I need home care. What's the first round of action?
So first round of action is I always talk about why they need home care physically.
Right.
Why? What's the need? So we go through the needs of the physical side. And then we will then follow through of, then my immediate is, okay, yes, we could get you home care immediately on the private pay side, but if long-term help is needed, then we have the conversation that goes into community Medicaid.
Right. And do you assist with community Medicaid?
Absolutely.
Tell me a little bit the 1, 2, 3s of community Medicaid.
Okay. Community Medicaid looks at the individual financially first.
Right.
So if there is any assets, we then will have an elder care attorney come in and do a trust or transfer. Because as of now, there is no look back on the community side. So that means an aide coming at home to your home, there is no look back. If a person is to reside in a long-term care facility, such as a rehab nursing home, then yes, that is a 5-year look back. So a lot of people will mix that up, and they'll say, no, we'll never make it, there's a 5-year, it's not. If you're having an aide come to the house, that's under community Medicaid, and there is no look back as of today.
How do you define community Medicaid?
Community Medicaid is a payer source. So you have private, you have community Medicaid, and then there are long-term care policies that may pay for your home care. But for the majority, community Medicaid is the primary payer source. And there are a lot of misconceptions about community Medicaid, the eligibility process and who's eligible versus who's not. In fact, most people are eligible. It's about who you go to and the knowledge of the people that you're working with that can make the process easier to navigate.
That sounds like a great idea. I'm going to emphasize on that a little more, but we have to take a quick break. When we return, we'll continue with the conversation with Danielle Gallucci and Mildred Gallery on community Medicaid. Welcome back to Talk with Maria. We are talking with Danielle Gallucci and Mildred Gallery from GR Home Care about providing critical care with compassion and empathy. Mildred, we're talking about community Medicaid. A lot of people don't understand what community Medicaid feels like, understands. What's the definition?
I'd like to say that, so Medicaid is a tree, I'm going to just say that, and community Medicaid is a branch of the Medicaid tree.
I love that definition.
And the community Medicaid is a payer source for our home care when we get to the place in life where we need it. So we're paying into it, and we're paying into it, and when it gets to the point that we need it, we can draw from it. And that is in the ways of applying for it. Now the eligibility process it navigates different depending on your resources, income, equity. If you have
there's a cutoff
assets versus not. But what I can tell you is that if you are already someone that is on the on the Medicaid tree, transferring or receiving community Medicaid services is an easier step than someone that isn't already on the tree. But getting on the community Medicaid tree is eligible for everyone. It's a matter of knowing how to become eligible. And Danielle can speak to
Yes,
some of the
Danielle.
ways.
So one of the first things that you do once you've analyzed the patient, if there's a need for community Medicaid and their resources lends to over the budget, you would then refer them to an elder law attorney.
Correct. That's
Yes.
right. Right.
And then so once they've sorted their look back, if they're going into, a lot of people don't understand, going into a nursing home is very different from having home care.
Correct.
You want to define the nursing home process.
So if somebody's going into a nursing home who's going to remain there long term,
Yes.
that's where that 5-year look back comes in.
Nice.
If someone's to come home and applying for community Medicaid, there is no look back at all.
There is no look back. So now this person is ready.
Financial look back, I should say.
Financial look back. So when people hear financial look back, everybody starts shaking because everyone wants to leave a will for someone. They want to leave money for their daughter, for their grandchildren to go to college. They want to have their hard-earned money that they've worked for. It will not stretch out to as long as they may be ill, because of course you have to be ill for more than 125 days to be eligible for community Medicaid. And so once you've defined that, and this person is getting into, say, having Alzheimer's or having some sort of disease that would last longer than that time, and they look at the amount of money that they have and say, you know what, I may have $100,000, but this may not stretch if I last for another 20 years.
That's right.
So now we'll talk to an elder law attorney, and he would be able to move things around and allow us to understand better how this money can be spent and where these resources can be placed.
Yes.
For community Medicaid to be then afforded.
Yes, you can put your assets into a trust.
Yes.
Or you can transfer them.
And
Very
the
much
state
so.
does allow you to have X amount of dollars in order for you to be eligible. So the amount currently?
I think they just raised it, and I think it's 32,000.
Yeah, in your account.
Correct.
And what if, and I know that the state also wants you to have a pre-need where you have to have all your pre-needs met, meaning pre-needs, and one of these days we're going to have one of our funeral directors on here. You have to have your funeral arrangements made. You have to be paying into your funeral arrangement. A lot of people don't want to talk about funeral arrangements, but it's a very vital thing to speak about. Your body is very important. And Mildred, I often say, after we've glamorized this wonderful body of ours, and we've gotten to the stage where just our spirit is working for us, we want to be able to understand that we're not leaving that as a burden for someone else.
Absolutely not. And some, I know for me, I'm a bit of a control freak. I want to plan things so that my children don't have to worry about, is this what she wanted?
Yes.
Did she not want that?
Guesswork.
Or them to fight over it.
Yes.
I don't want them to be mad at each other. She didn't. No, I'm going to leave who I want, what I want.
Right.
And if you're going to be mad, you can be mad at me. Don't take
Right.
it out on anybody
I'll be already
else.
dead. Who cares?
I want to have the last say. Or
Right.
God forbid, any of us get into a position where we cannot make these decisions. Do I trust you to make that decision for
Right.
me? I don't know. Maybe you'll say you want me to live on life support, and I don't want to.
And you know, that's very important. Since we're on the topic of home care, keep in mind that having a power of attorney, Danielle, I imagine, what do you tell your patients about power of attorney?
I definitely recommend to have one.
Yes.
Because if the day comes that your mind is not working well, if there's dementia, Alzheimer's coming in, you want to have an appointed person to make those decisions for you.
Totally agree. And of course, a trust. A trust is like another person. It's like you and your trust. So you can put all your assets in your trust, and then that would be another person, mentally and emotionally and physically and technically another person in your life. And then, of course, people negate and do not ever want to talk about doing a will. A will is critical. You must have, even if it's the cat or a pocketbook, leave it written down. And there's the poor man's way of doing a will, where you handwrite everything, you put the date on it, and you seal it, and you put it in an envelope. And you could have it hidden in your underwear drawer, but at least somebody knows that you wrote it. It's got your signature on it. Or nowadays, with Google, you can Google a will, Mildred. Yes. Have you Googled your will yet?
No. But what I want to say about that is, it just came to me, that if you don't leave a will, then
you have to go to probate.
Well, not just that, just on a human level, then you don't have the last say. in what happens in your life.
Technically, you don't.
Yeah, so have a will so that you have the last and final say about how you leave this earth.
I totally agree. Danielle, how do you deal with patients that call in and when you ask all of these pertinent questions, they draw a blank?
Or why don't you talk about this frustration too, how frustrated families are, and we understand how frustrated they are when they come into home care and they're scared and terrified and they may seem angry.
They do. So I definitely, as I said earlier, show much compassion and kindness to them. And I definitely educate them as much as possible and will give them every resource that is available to them.
You must be so resourceful, Danielle.
I am.
All the numbers on your little black
She
book.
knows a lot of people.
Yes.
Yes.
So I'll educate them on all the resources out there that's available to them. So that once I sit down with the family, we have a very lengthy conversation of the resources, then they feel better. They have options,
sure.
and they're a bit educated, and then they'll speak to the elder care attorney, and then they get more educated.
Yes.
So after that occurs, then they'll feel much better. They know they have some options out there, and then they could choose wisely to move forward.
And it's going to be okay.
Totally.
And that,
Yes.
things will be okay.
And some
It
of the
will.
people that are looking that don't have anyone to turn to can still call Danielle at GR Home Care. And I'm sure you have resources that you can refer them to because sometimes people don't understand what to do.
Correct.
It's very
Absolutely.
important.
And sometimes when you have a family member that's in a facility, you want extra eyes on them.
Yes.
So, we also...
And in a facility,
Yeah.
Mildred, I like that. Home care, private home care in a facility is great because the nurses are busy, doctors are busy, things are happening. And when a client sits in a facility and they're alone and they have no one to speak with and they're encountering pain, they want to have someone to speak with. And that's where Gerard comes in with
Absolutely.
private care. Someone that just stands there, hold their hands.
Yes, and supervising them
Yes.
and playing cards, just being
Conversations,
present
yes.
and making sure that client and family is happy.
Yes.
And so with home care, what our goal and what most home care's goal, if it's good, is to mimic what you would be receiving at a rehab center at home, so that you can
Yes.
stay home. So that's what we want to do. We set you up with not just home care services that's invalid, but OT, PT, all of the things that you would be receiving inside of your rehab center. We want to bring it home so that you could stay home.
We're going to have to take a quick break. We'll be right back. We'll continue our conversation providing critical care and compassion, empathy with Danielle Gallucci and Mildred Gallery from GR Home Care. Welcome back to Talk with Maria. We are talking with Danielle Gallucci and Mildred Gallery about discussing the impact of home health care services. Thank you, Janelle and Mildred, for coming. This is so important to the world to understand how home care works. Danielle, now you've given all the information to the client. Now they're ready to get on board. What's your next move?
So, well, first things first is that if most people that come to me don't have any setup of community Medicaid. So we'll start them off on the private side. And in turn, we'll have the community Medicaid application getting started.
Nice.
And then on an overall, just so I can educate on this piece, applying for community Medicaid typically lasts about 3 months. So there's certain documents that are needed by the state, and the family would have to gather those documents, send them out to the elder care attorney, and the attorney then will put the application together and send it out to the Department of Social Services. It typically takes social services about 3 to 4 weeks to review it and then send back the acceptance letter. Once the acceptance letter does return, that's our green light now to get moving, so that we can now have the families call out to have their NIA assessment set up. That's New York State Independent Assessors. They'll come and do 2 assessments. And then we'll have a managed long-term care insurance plan come out to do another assessment. So
all
typically,
the assessments.
yes, all those
To
assessments.
make sure that you are who you are, you're not in California saying that you're someone else, that you are totally ill, that you need home care for more than 125 days, and that having a home care person for your 5 ADLs is critical to your advancement in living. And that is such a wonderful thing for GR Home Care to be providing.
Absolutely.
Yes.
Yeah, so we work very quickly in trying to get them onto the program because most people don't have a lot of funds to privately pay.
Right.
So we work super fast in doing that. And the typical, like I said, turnaround time is about 3 months.
So there are specific days, and when you're applying for community Medicaid, if I understand correctly, that you
Yes.
you cannot miss cutoff dates. So
There
it's-
is a cutoff date,
Oh,
yes.
wow.
So that's
Cutoff
why
dates.
it really does make it makes it better to work with an agency that knows these things, because you can miss time frames, and then that can delay your care even longer.
It's like a
and
quiz question
you'd
now.
have to pay
First of the month.
You'd have to pay privately for longer, right?
That's right. And there are some people, even though they could be very smart, very intelligent, but if some people do try to apply on their own, and the application is not simple, even though these people might be very intelligent. And what happens is they do the application on their own, and it gets denied or rejected. So that could set them back a whole nother 2 months. So we're here to provide that very skillful application to have happen. We have certain eyes to do it and make sure it's right and gets submitted properly with all the documents. And like I said, that typical turnaround time is 3 months.
Is there a specific elder care lawyer that you work with that you want to talk about?
Yes, his name
Yes.
is Sri Saperstein, and he's wonderful. There's always
like
a free
that.
consultation. We never
Always.
charge.
Free
Yes,
consultation
yes.
from Saperstein and Saperstein, elder law attorneys. Pick up that phone and call them.
Call them, really honest, if you want to be guided the right way. And we have learned to navigate this pretty well. And we feel confident in that. And that's the reason why we're having this conversation, because we know that there's so many people that don't know how to navigate,
Yes.
even an agency. And then they drop the ball, or something happens and they're not eligible, when in fact they were eligible. Then the family may think, well, we're never going to be eligible. No, you weren't eligible for that application for when they, but we can now apply again for you, and you will be eligible. So there's so many misconceptions about eligibility for Medicaid.
And that's why you have to go out and get the right information.
Yes.
And having an attorney that can guide you, and having an agency like GR that can give you the information that would take you to that next level. It's one thing that you're already ill, or your family member is already showing signs of wanting care, and then you're all in this big muddle of trying to get it together. Just come to a company that would assist you, that would cut some of the stress away and allow you to think and understand all the terminologies that would get you care. Because I'll tell you another thing, Medicaid has a very strict time of start, and they never stop the care at the end of the month. They start it at the beginning, the first of every month. Whoever came up with this wonderful theory, first of every month. So once you have all your documentation intact, the first of the month is your start of care. But you have to have all these extra interviews that would take you into understanding how many hours do you need, how can they best help you to stay alive, stay in your home, stay comfortable with compatible care. Let's talk a little bit about your home health leads, Mildred.
I recruit, and I go to many different schools, and I'm not going to say names, and I'm not just saying this because I'm sitting here with you, but people that come from Home Health Aid Training Institute, you could see their confidence, and you could see what they've learned versus other home care people that I recruit, that we then have to make sure that they have extra training, because maybe they haven't received the training,
That level of care.
that level of care.
And then which leads us into a little bit of the change with the CDPAP.
Currently, under the Consumer Direct, our family can take care of us, but they don't necessarily have to be, they're not trained. A lot of things can happen, because you can love your family to death, And I mean that in a very serious way. Because you love them doesn't mean you necessarily know how to care for them.
Yes.
You can know everything about them, where they have their bruises and how they sound when they swallow and all those things you can tell me, you can tell us. But a home care worker is trained to see things that you may not.
Yes, it is a vital part. If you really love your family, don't think a headache is just a headache and take two Advils. That family member might be getting a stroke, and you don't want to mismanage or diagnose. You want to understand. And having home health care training is very important. Danielle, when you have a compatibility now with a client and a compatible aid, what's that feeling inside?
Well, I must say, coincidence that this happened today. We had a family that we had on service for a very short time. They came home under hospice, and I had, unfortunately, she had passed away within a few days. But I had spoken to the daughter, and she had said that she had the most two wonderful home health aides that came to her and to her mom, and made her family, not just herself and her mom, but the rest of the family feel such at ease. And she couldn't have been happier with the care that they received.
JR Home Care, it's been an honor to have you both.
Thank you.
Yes, thanks for
being here.
Thank you, Mildred, for disseminating the information. I look forward to having another episode with you. There's so much to talk about in home care, all the fair pays and all the other stuff. You're such a flat-foot hustler when it comes to ensuring that healthcare gets to the next level.
Well, everyone here is sitting at this table. We love home care. It's important to us.
It is so important. So, Mildred, why don't you give us the number or the website that one can reach at to get wonderful care from JR Home Care?
Our website is grhomecare.com.
Thank you for joining me on the Talk with Maria show today. I hope you found our conversations informative and inspiring. Visit our website, talkwithmaria.com, for resources and information. Share your thoughts on social media using hashtag #TalkWithMaria, and tune in next time for more inspiring discussions. Stay healthy.
Talk with Maria is made possible by... If you're passionate about helping others, become a certified home health aide with Home Health Aid Training Institute, 516-333-3689, or visit hhati.com. Experience the authentic taste of Italy in the heart of Westbury, Rialto Restaurant. Make your reservation at 516-997-5689. Brooklyn Boulevard Home Care. They care for you in the comfort of your own home. To schedule your care, call 718-683-8303.